The 2020 Minority Health Film Festival offers a diverse variety of films and events that we just wouldn't be able to offer in the in-person cinema experience. But I think what really makes it unique is the focus not only on public health issues, but the issues that really concern communities of color. If you're looking for a reason to engage or to try it out, this is the perfect time. Just go to mkefilm.org/MHFF.
Good afternoon, and thank you for joining us. My name is Deborah Nevels, and I am the program coordinator for Fredericton and the Medical College of Wisconsin Cancer Center Community Outreach and Engagement Team. It is truly my honor to be with you today. I invite you to grab your lunch, grab a friend, tell others to join us because you are in for a treat in a great conversation today. Today, we are going to be talking about revisioning cancer for women of color. And in this discussion, we are truly blessed by a talent and artist, Nina Kennedy. Nina comes from Manhattan. She is joining us today, and she is a concert pianist, world-renowned. Started playing when she was 9, and then at 13, she was playing Gershwin Rhapsody. Be Still My Heart. And Nina, not only is she a concert pianist, she's also an orchestral conductor. She has a program that I strongly encourage you to tap into, Noshing with Nina. So she is a host within herself, so I don't know what I'm doing, but she is going to walk us through her journey, a little bit about her journey. Oh, also, she created a film, which I think we also need to look into. A documentary about Matthew Kennedy, One Man's Journey, a story of her father, which is incredible. She has won many awards, has traveled the world, and we are just blessed to have you in our presence today. So thank you, Nina, for joining us.
It's my pleasure.
We are also joined, some of you already know this young lady. Her name is Dr. Malaika Psycher. And Dr. Psycher is with the Medical College of Wisconsin. She is an associate dean for student diversity and inclusion. She also works with radiation oncology. And as I have told you all to pull up your lunch, Dr. Psycher has joined us in the midst of her day, which we are so appreciative of her time. So she has to eat her lunch. We got to keep her nourished. So we want to continue involving and inviting her. Today, we are what has started our conversation. And I pray that all of you had the opportunity to watch Audre Lorde's film, The Cancer Journals. The Cancer Journals, an incredible documentation of her fight of breast cancer. She explores a little bit about her journey, and she breaks it into 3 parts. And I want us to use this opportunity to kind of have this discussion and to elevate the voice. One of the quotes that I love from Audre is that feelings need a voice. Feelings need a voice in order to be recognized and respected and of any use. So our feelings need a voice. And as we look at Audre Lorde, who is an incredible Black woman, she was an activist. She was also gay. She spent her years fighting and writing poetry, and basically looking at how to uplift underrepresented communities. And her journey was just phenomenal. And I want to open up and start by opening up, asking Nina just to share a little bit about your journey, and just about, we want to also incorporate the discussion of that intersectionality, being Black, being female, the intersectionality of being is so critical in this discussion. And so Nina, if you could open this up and just start a little bit about talking about your journey.
Sure. Well, to start, I want to let everybody know that I have a new book out.
Yes.
Practicing for Love, a memoir. You can order your copy. You see, I have my production company shirt on, Infemnity Productions. And the website to order is infemnity.com/shop. But I bring that up to say that I had been invited to present at the James Baldwin Conference in the south of France It was supposed to be this summer of this year, and of course was canceled because of COVID. But I was asked to present, and also moderate a panel. And I had begun my research for that conference and doing a lot of, James Baldwin's readings. And I found, that he had died of cancer. And I had begun my research on how the cancer really manifested in his life and what else was going on in his life that may have contributed to that. And then in my research, I turned the page. I just took out my own cancer journals just recently and found that the beginning of my cancer story started on the next page. Um, that word, it's so frightening. And I realized that at the time I was diagnosed, I was under a tremendous amount of stress. uh, Went to Europe, to Vienna, to shoot this music video, and all of the responsibility was on my shoulders. So, and then I realized when I got the diagnosis, I didn't believe it at first because I've been going for my regular mammograms, and I had these calcifications, but never had a malignant result. And then when she said it was malignant, I felt like I was about to pass out. I had to sit down, and people came in to look after me to make sure I was okay because I had lost a partner to breast cancer several years ago at 33 years old. So, of course, I imagined the worst case scenario. And they reassured me that with the diagnosis that I had, I was stage 0. And the doctor told me, 30 years ago, they wouldn't even have been able to make this diagnosis. So she said my prognosis was excellent. They found it early enough. So I went in for the initial surgery in last December. And then she said some of the malignant area was too close to the skin. So they encouraged me to have the full mastectomy just to be sure that it was no longer an issue. So that happened in January. And within the next month, here was COVID. And all of my follow up appointments had to be postponed and were canceled. I had an excellent breast surgeon, Dr. Sarah Kate, here in New York, and the plastic surgeon was taking care of the reconstruction. And then after the abdominal tissue was taken for the reconstruction, my fibroids became an issue. So now we have to schedule for, at my age, there's no need for my uterus. I'm not going to try to have any kids. So all of that's going to go within the next few weeks. So I'm still kind of in the middle of the journey, but it's been something else. I tell you, I couldn't have imagined just the effects of living with this and watching the effects on my body and living with the scars and this adjustment around just movement. It's a constant daily reminder of what I've been through, and I'm very lucky to have wonderful doctors here in New York and wonderful insurance plan. I consider myself very lucky.
You talked
So that's a
about,
little bit.
yeah,
Go
you
ahead.
talked about, I'm sorry, you talked about the stress that
Mhm.
you were under at the time, and um, thinking about some of the people that we serve, and just the underrepresented populations where we have individuals where stress is a major factor.
Right.
Um, and trying to walk through, navigate the systems. You talked a little bit about your doctor being and the team that you worked with was very helpful. How much of a role do you think that really plays once the diagnosis? I mean, having individuals around you who actually hear you, how much of a role does that play?
Oh, it's enormous. It's enormous. You really you have to feel like you can express yourself with the doctors. And I know sometimes I have a tendency of just kind of going blank when you're there in the office and the sterile environment and everything's white and just being intimidated
Mhm.
by these professionals. But I really have to force myself to remember my questions and ask them, maybe write them down in advance of the appointment just so that I know what's going on. I was told that the cancer was responsive to the hormone
Mhm.
therapy, so it evidently was producing a hormone, and I didn't understand if there was a connection between my uterus or my ovaries or how that was involved. I mean, I really needed somebody to explain to me that no, actually, it was the cancer that was producing the hormone. And now I'm taking the anastrozole for to the hormone blocker. She said just to protect the other breast to lower the chances of any recurrence. And but the cancer was completely contained, so I didn't have to contend with any spread or that extra worry. But yes, the stress, I really had to re-examine how I was living and what my priorities were at the time. I mean, as I said, we had gone to Vienna to shoot this music video, and I felt like I was finally taking some solid steps toward gaining some of the recognition that had been due all my life. You know, as a Black woman, you know, I've been kept out of the circles where these decisions were made and where contracts are given. And, you know, it felt like I was finally just staking my claim and
Mhm.
not waiting for anybody else, you know, to recognize me, and just going out and producing these things on my own. And evidently the stress got to me because it was just too much on one person. So if anything, this story has taught me to delegate and to share what I'm going through with as many people as possible, because you have to have a team. You have to feel like you have a team of support, especially when you're going through something like this.
Mhm.
So I've had to change quite a bit of thinking and patterns, and to recognize that, you know, nothing's more important than your life,
Yeah,
you
yeah.
know, just to give your life that level of importance.
So true, so true. Dr. Psycher, I want to bring you in at this point with regards to how we support our students and support training. So that is an approach that focuses on the whole individual. Um, and some of the work that you've been doing around diversity and inclusion, specifically working with our students, has been awesome. And just want to talk a little bit, and you may be muted, I'm not sure. Here we go. But just to talk a little bit about some of your experiences and the impact that you're having.
Well, first, I want to thank you for inviting me today to participate in this conversation. And thank you so much, Ms. Kennedy, or I'm not sure, Ms., Mrs.
Just call
Do
me
you have a
Nina.
preference? Nina. Okay. Thank you, Nina. You can call me Malaika. You can, maybe we can go by first names on this chat today, but for
Okay.
including me in this conversation, to have the opportunity to discuss many of the things that I'm passionate about, both personally and professionally. I'm advocating for, you know, patients with cancer, and talking about diversity and inclusion in the and medical education are two areas where I work very tirelessly. So as the Dean of Associate Dean for Student Inclusion and Diversity, we are tasked with ensuring that our workforce, or our future workforce, resembles the diverse communities that we serve. And right now, if you look at the number of individuals who identify as Black or African American in United States medical schools, it's less than the general population. So about 13% in the general population, but in medical schools, you know, depending on the year, you know, around 7%. So we have a ways to go to ensure that our student body resembles our community. And that becomes more imperative when you have a school like Medical College of Wisconsin with our close proximity to the city of Milwaukee, which serves a large Black population. So our work centers around, you know, pipeline programs, exposing pre-medical, you know, middle school, high school, college age students who are interested in health science careers, obtain the experience, opportunity, advice in order to get into graduate schools or graduate programs, but more importantly, working on the other end, ensuring that the students that we have at Medical College of Wisconsin find the Medical College of Wisconsin a place where they feel celebrated and can thrive and feel valued. And so a lot of our work is focused on that. And I know from our patients, they appreciate having a diverse medical team. And when I have a student of color shadowing me, and my diverse patients see that, there's something a little bit extra special that happens in the room. So it's really imperative that we, cultivate that diverse workforce. And again, to your point, Deb, it's more than just, treating cancer patients is more than just mastering medical knowledge. It's being present in the room for NINA and for cancer patients, making sure that they feel listened to and appreciated and valued by the medical providers, because it truly is a team.
Awesome. Thank you, Malaika. I think part of what I'm also, when we talk about the intersectionality of this journey and existence, and all of the things that we have to do, one of the key things that Audre Lorde addressed and kind of looked at in the second part of her book, and of the film, was looking at breast cancer as a Black lesbian feminist. And it's the way that she spoke to that so eloquently, and walking through her journey, recognition of the omission of that part of her life, and the relevance of that part of her life. I think that was also something that was difficult for her, and obviously in the writings, it was something that was hard, of not being acknowledged and identified as a whole person. And Nina, I was wondering if you could speak to that intersectionality, with regards to your journey, or what you feel is relevant. And part of what we want to do is use this time for us to be able to express to the medical community what all needs to be paid attention to, so that you respectfully approach individuals as a whole.
Mm-hmm. Yes, well, as you're talking, I'm reminded that I didn't have any contact with any African Americans from the beginning of the cancer battle. No doctors, maybe one nurse. But, and there again, I'm here in Manhattan, there were hardly any African Americans I saw, certainly no doctors. And I'm reminded to tell you that my grandfather, my maternal grandfather, had been the president of the National Medical Association. He was one of the first African Americans to graduate from the Yale School of Medicine, and served as president of the National Medical Association in 1911. And for those of you who don't know, the AMA was in existence, but they didn't allow African Americans to join. So the National Medical Association was formed for African American doctors. And I have a wonderful photograph of that group of Black doctors taken. He was based in Charleston, West Virginia, but with the old Model T Fords in the background. It was really, really an incredible history. And they're still very active, National Medical Association. They have a Facebook page. And they're a good source for advice for incorporating people of color and minorities. But, and yes, I was born in the Meharry Medical College. Well, it was Meharry Hospital when I was born. My parents were on the faculty at Fisk University, right across the street. In fact, they said a lot of women went to Fisk to get their MRS degree from Meharry men back then. But yeah, it's Meharry Medical College now, and that's a wonderful place for just turning out Black doctors. Their roster is growing every year. But we're seeing a backlash, as everyone knows. A lot of the funding has been cut, and there have been quite some difficulties for some of these young people just to be able to finish their education. And we're trying to find ways to be as encouraging as possible, even if some of us can't contribute financially, which is the case for a lot of us in the midst of this pandemic. Just to encourage them morally, just to get in there and finish your degree and do what you can. Everybody knows this is a really rough time, and some people taking advantage of that.
Mhm.
But we are here to support.
Yeah, yeah. That's working with, I mean, the importance of having, being able to walk into a room and see someone who looks like you. As Malaika was saying, it makes a difference in the journey, and makes a difference in how you are treated and what the interaction looks like. I think that,
Hmm.
you know, being able to acknowledge and being able to be relatable and build that relationship is key. It's truly key. Malika, as we talk a little bit about uh, going through the journey and working with clinicians, and recognition of that intersectionality, what are some of your thoughts as far as how we can uh, be more responsive to our patients in underrepresented communities through training of our students and hopefully making systemic changes within our medical schools?
Yeah, that's a really great question. I mean, beyond the obvious one, which is to diversify the students and faculty and leadership, it's that's not going to happen overnight, and we're working really hard. And frankly, we've been working really hard for decades and haven't made a ton of progress in some areas. African American males, that's one particular area where we've actually gone a little bit backwards compared to the 1970s. So, in the meantime, we know that physician patient race concordance can, not only does it, feel good or like there's data to show that it improves patient outcomes. Patients are more likely to trust their doctor, communicate with their doctor, and listen to their doctor's advice when there's that concordance. And there was just a paper that came out last month in the Proceedings of the National Academy of Science that showed a mortality benefit for Black neonates, Black newborns when cared for by Black doctors. So, now we're talking about, saving lives and saving the lives of babies. So there's a lot that, we can't wait for the diversity to arrive. So we need to start working on that now. And that comes exactly what your point to the way that we are educating our future health science workers. And, we have to be able to be okay talking about things that make us uncomfortable. Our public health officials have declared racism a public health crisis. We need to be okay talking about racism and talking about how that affects the health of our patients. So I think understanding racism and being able to name it and call it out. And then I had the privilege to listen to Dr. Kamara Jones on her session that she had with us last week, and go back to her framework, being able to name racism, ask the question, how is racism operating here? And lastly, organizing and strategizing to act. And so we have to teach our students to do those three things: understand what racism is and how it's affecting public health. 2, constantly asking the questions. We can't get lazy. We have to always be asking ourselves, how is racism operating here? And once we figure that out, figure out ways to overcome it.
Definitely. Thank you. That so makes a difference. Nana, I want to go back to you, and we have a question. Your trust experience.
Yes.
As identifying as a lesbian African American woman, it's your trust experience during your journey. Has that been impacted at all by interactions that you've had?
Yes. Well, luckily, as I said, I'm in Manhattan, so it's not such an issue. I guess we have the most liberal, you know, uh, square mileage in the country. But my partner comes with me to my appointments, and it's very important to me that she's able to come and able to feel comfortable in this environment. And she's able to keep track of what's going on better than I can, because my head is just whirling when I'm in the doctor's office. But I'm very lucky and very thankful that I can live in a place where it's not such an issue. In fact, even on the forms when we're coming in for the appointment, the forms we have to fill out, you're asked your gender preference, your pronouns that you would prefer, um, questions regarding your status, whether you're lesbian, bi, heterosexual. So they've set up an environment to make you comfortable with those issues before you even go into the office. So here in New York, I guess we're very progressive where these things go. But I am involved in the National LGBTQ Cancer Network, and we've just finished a questionnaire
Okay.
for people to be able to fill out and to just get people thinking in terms of their comfort level, because we have several people come to us, especially trans women, who really have to worry about the kind of service they'll receive, if at all,
Mhm.
once it's revealed that they're trans.
Mhm.
So my issues are not so extreme, and as I say, I'm very lucky. But we do need to remain aware of those who uh, might not be so lucky and way out in the Midwest, who might not feel that they have an organization to back them up. But that is something I would suggest, to seek out LGBTQ organizations and let them know what your process is and where you are in your struggles medically. If you're, just thinking about going in, or if you're in the middle of your process and you've come against some discrimination,
Mhm.
just to be diligent about your note taking and name names. These people need to be called out if they're not able to offer unbiased treatment, and to keep people involved. You need your community to help you get through something like this.
Awesome. Thank you. I think part of it is not only, seeking out the support, but also being able to speak your truth and feel comfortable speaking your truth. Were there things that you wish people would have asked you, or wish that others would have known as you began your journey, Nina, or wish you would have known um, as you began your journey?
Um, well, when I received that initial diagnosis, my doctor, I need to go back and say, she was an African American woman, that first gynecologist I went to see. And she made it very clear to me that this, explaining the stage 0, and that the prognosis was good, and that they couldn't have made this diagnosis 30 years ago. Um, I was fortunate to have it explained to me in that way, because my only frame of reference up to that point was the worst case scenario.
Right.
My partner had died at 33 years old, and she had that really rapid growing cancer. From the date of the discovery, she died 2.5 years later. And so when I heard the word cancer, that was my immediate association. And I needed someone to explain to me that this was not the case. It was a different kind of cancer that I had. It was slow growing. It was contained. It's like when you have such a shock to your psyche. She may have said the same words to me 3 times, and I wasn't able to hear it because I was so wrapped up in shock.
Mhm.
So, and she seemed to be the kind of doctor who had an awareness of that kind of reaction. But she didn't occur to me because she wasn't one of my surgeons. She was the one who had requested the mammogram and went through the results with me. But once it got to the surgical team, that was when I was in the white neighborhood. I couldn't find any people of color.
Mhm.
But I felt I'm pretty uncloseted normally, so I really didn't have an issue making that clear that this is my partner. I know everybody isn't like that, but like I said, you got to have your support, and at least having her in the room with me, especially with the plastic surgeon who's a man. And I asked if there were any women I could go to, and at that point they couldn't find anyone else, but he came highly recommended. So everyone said how wonderful he was. So and he had no objection to my partner being in the room with me.
Awesome. Dr. Psycher, talking about that and recognizing not all support systems look the same, not all families look the same, that we have to do the best that we can from medical provision standpoint, and offering and making safe space and room for partners and support systems, no matter what they look like, to come in. How do we prepare our students for something that they may not be comfortable with? Because med students, I just know our demographics, they come from all over the place, and you can get individuals who are just not familiar with diverse families, let alone diversity from ethnic or racial backgrounds. But it's, how do we become that? In earlier training, I'm going to use this. How do we become that domino to make a difference and to make safe space so people feel comfortable getting and receiving the care from us that they need?
Yeah, I have two thoughts around that. I think that one has to do with leadership and the other has to do with accountability. And so from a leadership standpoint, here at Freighter at the Medical College of Wisconsin, we've truly been a leader in terms of LGBTQ health. Dr. Petrol and team with the Inclusion Clinic, that's one of the first of its kind, at least in our region, which is a clinic that focuses solely on individuals who identify as members of the LGBTQ community. At our cancer center, we were planning, it was supposed to be, I don't know, probably this weekend or last weekend, we were going to do a cancer disparity conference on LGBTQ cancer disparities and bring in some, national experts and patient advocates, and unfortunately had to be canceled due to COVID-19, or I should say postponed, because we want the full, in-person conference when we do that topic. Our medical students started a few years ago a transgender health symposium. So on their own, they put on a yearly symposium that has to do with transgender health. So our students are seeing from leadership that this is something that's important, that we value. And the second piece of that is accountability. Our students have to know, to graduate, they are going to have to become familiar with pronouns, with using certain terms. They have to be comfortable taking a sexual history. If not, they can't graduate. They can't pass. So I think it comes from both. I think with leadership and accountability, you can start to change culture, and the students will learn that this is something that's important for them to be a great physician.
Dr. Psycher, I want to stay on you. We have a question with regards to actions that participants can take to decrease cancer disparities and prevention and long-term outcomes in communities of color. What can people do to promote that? And we've got to tackle this, and we've got to make a difference in our numbers for the communities of color and our underserved, underrepresented, and hardly reached communities. What steps do we need to take?
Yeah, that's a great question, because we're not all going to be our now retired beloved Dr. Walker and be able to be, the celebrated, breast surgeon who helped, thousands of women in Southeast Wisconsin. So we can't all be Dr. Walker, but, all of us probably know somebody. So I think, you start small, you start focusing on the people that are closest to you. So if you're a person of color, look at your family, are you encouraging your mom, your dad, your siblings, your kids to go out and get screened? I mean, that's like the easiest place to start, is start with the people that you know. And beyond that, get involved. start tweeting about it, start talking about it. And, all of a sudden you'll find yourself, communicating with community leaders who are talking about these things, getting involved with local organizations. So I think by starting small and growing out is the best way to get involved.
Awesome. Nina, your thoughts. How do we impact the cancer burden for our communities? What would be your suggestions?
Well, I know one of the biggest challenges for me initially was just worrying about the financial aspect. And I was encouraged to just apply for Medicaid. And that is no small feat because it's a lot of paperwork and a lot of red tape, but keep at it. Even if you're rejected the first few times, just keep applying, because I know of a lot of people who won't even go to a doctor just out of fear of what it's going to cost. But the Medicaid has just covered every aspect of my treatment completely. And yes, I am very lucky. I don't know what I would have done without the Medicaid. And even with other insurance options, turn off the news because all this talk about Trump and the Republicans and what they're trying to do, it's an added stress that we could just eliminate by turning it off. Because every day they're showing that Trump in and of himself is causing added stress on the Black community and directly affecting our health. So just turn it off. He's going to say what he's going to say, but you don't have to bring it into your home. And yeah, the insurance thing, I know that's a big stress for a lot of people, but just fill out the paperwork. Keep asking for it and keep applying. Eventually, hopefully, it'll work for you.
And in Wisconsin, we do have a program. It's a Well Woman program, which does assist and support individuals if they don't have health insurance. So there are programs that do exist to be able to help with the screenings initially, and then help with the treatment after. So that is critical. That is really important. Talking about just being in a space where, and again, looking at that intersectionality of everything that women in general that we face with our health. One of the key things, and you had mentioned your partner that passed, she was 33. Our guidelines wouldn't necessarily cover her, basically, on what, when she should have started mammograms and things like that. But it's difficult when we have guidelines that say one thing, but we have a family history that tells us to do a little bit, do something different.
Right.
Malaika, if you can talk a little bit about and I think about it from a family standpoint of the opportunities to learn more about family history being one piece, but having those difficult conversations, how you go about advocating for yourself. And I know you can talk about this too, because I know that you advocate too, but how you advocate for yourself when you know that there's a family history that might put you in a different category for screenings.
Yeah, I think that knowledge is really key, knowing that family history, because you're right. There's guidelines out there, but that usually there's a caveat, like if you have an early family, depending on the type of cancer it is, if you have an earlier family history, So I think it's about finding a doctor that has that cultural awareness. I know even for prostate cancer, for example, there's some different screening recommendations for men who identify as Black or African American. So finding a physician who is culturally responsive, who's up to date on these guidelines, in addition to knowing your own family history. And, not everybody has the benefit of knowing their family history. If somebody's adopted, Or, I know for a lot of in the Ashkenazi Jewish population whose family members might have perished in the Holocaust, and that's a population where there's a higher propensity for BRCA1 or 2 mutations. So sometimes, you could be at a higher risk and not even really know because you don't have the benefit of knowing that family history. So, yeah, I think it's really important to make sure that the physicians that you have are culturally responsive and up to date.
Awesome. Nina, from the advocacy side for self as patient, what are your suggestions?
Oh my goodness. Well, I'm lucky I have my writing, and that's very important, just to keep a record of what's going on and just to help you remember, and to be able to look at exact dates and to remember the decision you made based on what happened on this day. I strongly recommend journal writing. And also to help you just formulate your thoughts in terms of what you want to express to someone else. While they're all still in your head, it can be, a little confusing, but and also just as a catharsis, just to get all of that out, as Audre Lorde did. Um, like when I started writing my own cancer journals, I remember seeing the words just. I couldn't get my mind around it. It was just such a shock to me that cancer, with that word, was being used as a part of my life, and it's yeah, it can really throw you for a loop.
Yeah.
But keeping as much of it documented as you can, and expressing the truth of what's going on, because how can you ask for help if you aren't honest with people about what's going on with you? And I remember seeing in my writings that I just felt this sense of weakness. I felt that here my body was letting me down, um, and I was in fighting mode up to that point. I felt like I was demanding justice and getting out there and feeling like I could take on the enemy. And then my body just said, hold on, you need to slow down and take care of yourself. And for some of us, especially now, there's so much racial tension and turmoil, and with the protests and with COVID, for God's sake. I mean, that daily stress of just going outside of your door and having to cover up and protect yourself. There's a lot of stress in the society right now. And if we aren't serious about it, and if we don't acknowledge it, it can we could just add to the level of stress by remaining in denial about it. So I would encourage people to just be honest with yourself and get as much on paper as you can, and continue to reach out, to build your support system and take yourself seriously. A lot of people just want to say, "Oh, you'll be fine." That's, how do you know that? I don't need to hear that. I might not be fine. And some people, of course, they may have the best of intentions, but for supporters of patients, the best thing you can really do is listen. Let the patient talk, because she's the only one who knows what she's going through, and let her feel free to express herself to you. As much as it may make you feel uncomfortable, and you may not be able to hear all of these details, but if you really want to be supportive, let her talk.
That's incredible. That is such a valuable nugget. And I think one of the things you've mentioned time and time again is having that support system, and being able to have, and then that's why it's so critical and important, when clinicians see family structures that may not be what they expect. You have to recognize and respect that who I decide to be, the support that's going to walk with me through this journey, you have to recognize it, and be able to utilize and also take care of, how you're helping and assisting and supporting that person. And like you said, your partner comes with you, and she's able to kind of fill in blank sometimes.
Right. Remember, she was negotiating my cup size with the plastic surgeon. Like, the two of them are deciding on what my cup size is going to be.
You're
Like,
just
okay.
like, okay, what she said, yeah. But that's so, I mean, it's so important to understand that, I mean, we laugh about it, but it's so, it's something, one more thing that you don't have to think about possibly, or a discussion that you've had before, that she remembers exactly what it is that you want. And it has to be respected. I mean, it's so, so important, when you're going through this journey, that it's recognized that there are supports and that there's somebody who's going to know you better than you do sometimes. Somebody who can protect you from somebody going, oh, you're going to be okay, sweetie. No, she's not. Leave her alone. Go sit down. I got this. But yet somebody who can be in that space. And it's so critical. And I think about even when we talk about work and support around caregivers, that has to also recognize the diversity of what a caregiver, who that caregiver may be, that has to be acknowledged too. Um, it was, you have such a wealth of outlets, if you will, from me looking in, for just as brief as I've gotten to know you, Nina, is you're a pianist, you are an author, you are a filmmaker, very cognizant of everything that's going on around you, but your outlets and how you relax, when everything seems to get crazy on the outside, and not ignoring the importance of the journey, but how you decompress. I know you talked about journaling, but sometimes that can be stressful. But how do you decompress? I can just imagine you sitting at the piano and just playing for hours on end, which is probably just my Disney world of seeing things, but of just being able to go play again.
Yeah, well, that could be stressful too. Yeah.
Yes. See, for me, I'm just like, oh, that would be just heaven. But I mean, how do you decompress? How do you take time for you?
Well, for me as a classical musician, the best thing that helps me just escape is just like sitting down with a 6-hour opera and just completely throwing myself into what's happening.
Ooh,
I've got my headphones on, I've got my widescreen TV, and just don't bother me for the next 6 hours. That's great for me. And I go there emotionally. I got my box of tissues. It's a complete catharsis for me. Aside from that, water. I'm a Cancerian. I'm a water sign, so
okay.
you will find me sitting. I live not far from the East River, just
Oh,
watching the waves. That does it to me. I can feel my stress level going down, just watching the waves and
yes.
hearing the sound. That helps me a lot.
Awesome. Dr. Psycher, we have a question for you. Um, Techniques that you use to help your patients feel comfortable and open up, and any advice that you possibly would share with patients about caregiver support.
So that's a really great question. Usually the first time I meet a patient is during a patient visit that, we call a consultation. So that's a new patient visit when you're just meeting a patient for the first time. And for me, it's obtaining a detailed history, doing a physical exam to determine whether or not I feel radiation therapy would be appropriate for that patient, or, how to manage their oncologic care, their cancer care. So I feel like when you're early in your career, the thing that you focus most on is like mastering of medical knowledge.
Mm-hmm.
And it becomes, and just think about it, just everything with medical training, it's passing exams and even how we select students and select residents. It's all about, passing those tests and making those benchmarks. And I think a lot of early physicians make the mistake of their top priority is, showing their patients how smart they are. And I think that when you get into your mid-career or once you get more experience, I think, your patients expect that you're smart or smart enough, but they really want you to be there for them and be their advocate and be someone that they can talk to. And that can be really challenging when you're meeting a patient for the first time and you're having to discuss things like cancer. So the way that I do it is I sort of follow the traditional, prescription that we're taught in medical school. Start with an open-ended question, and then you perform your detailed history, and then you perform a physical exam. Then usually after that point is when you talk about, have a discussion with the patient about the assessment and plan. And so usually at that point, I'll just take a timeout. And I ask all of my patients 3 questions. And I'm going to write an article or a book or something about it someday. So hopefully nobody who's listening steals this because I feel like it's really, really helped me at least center the consultation around what's truly important to the patient. So the first question that I ask the patient is, why do you think you're here to see me today? And that can be very telling. I've had patients tell me, radiation oncology sounds like radiology. Like, oh, well, I thought we were going to talk about, the scan that I'm supposed to get. And it's like, okay, wow, no, back up. I'm the doctor that gives radiation therapy to help with cancer. And so asking that question sort of helps me level set or gauge sort of what the patient's, understanding is about the visit that day. The second question that I ask the patient what's important to them. Because I feel like more than anything, on a cancer journey, what's the most important is to have meaning in life. And so that patient might answer, I have a daughter who's getting married this summer. I really want to be at that wedding. Or, a patient who's at the end of life might say, I just don't want to suffer anymore. Or, a young patient who might be facing a really aggressive disease might say, it's really important to me is getting a cure so I can live and be there for my kids. So I think that that's just a really important question, a really important thing that all physicians should understand, what's important to their patients as they sort of weigh the different options. And the other question that I ask is sort of the same question, but like the other way, because I feel like a lot of people, they want to be brave. They want to be brave for themselves and brave for their families. And so I ask that same question, but the other side. I say, what are you afraid of? And I feel like you can learn a lot about patients knowing their greatest fears. It might be dying. It might be suffering. And so I feel like having, making the space in the consultation to understand what the patient's understanding is, what they value and what gives them meaning. And lastly, what scares them really creates a space where patients start to feel like they can open up and trust me with the things that are keeping them up at night. For the second part of your question, what advice do you share with patients about caregiver support? That is a tough one because, I just feel that a lot of our patients, it's a lot of pressure being a patient. You've got to show up, and Nina could probably talk about this way better than I can, but you've got to show up and be there, to deal with your treatments. You got to show up and be there to answer from your doctors and nurses and other members of the care team, your friends, your family. It's like you never really get a chance to be with yourself, to sit with what you're going through without having to meet other people's expectations. So I think it's really helpful for all of our cancer patients to find someone they can talk to. We have a oncopsychology program here where we encourage our cancer patients to meet with a psychologist, but it doesn't have to necessarily be a psychologist who I sometimes will describe as, your best friend with a prescription pad. It can be a best friend, or it can be someone that you trust where you can just let your guard down and be yourself. And I think that same advice is good for caregivers too, because they're trying to be brave and strong for the person they're caring for and the other family and friends. But, maybe that caregiver needs someone to unload to. Probably not best that it's the patient, probably best that it's someone else. So I think that everybody needs an outlet where they can just be themselves. But, Nina would probably have some better perspective or advice around that topic.
Well, I can jump in there. I've been going to some Al-Anon groups here in the city. I grew up with alcoholism in my family, and I came across a lot of women who had cancer diagnoses, and in many cases, their husbands were alcoholics.
Mm.
And you listen to them talk about their lives, and the biggest stress in their lives was this alcoholic husband. And for them to be in a position of having this diagnosis and having to contend with having him around, in some cases, I just wanted to say to them, just leave him. He's the one who's causing your stress. Get rid of him. You don't need this in your life. But for a this was out of the question. They're trying desperately to keep the marriage together for their family's sake and everybody else's sake, but they're literally dying from the stress that's coming from having an alcoholic spouse. So I know this isn't talked about a lot, especially in the Black community, but there is a lot of alcoholism and there is a lot of substance abuse, and not so many places where people who are family members can go and express what they're going through as a result of living with this. This can cause enormous stress. Another friend has an alcoholic brother, and the stress that this one person is causing for the whole family, it's just a nightmare. And they aren't necessarily going to acknowledge that they have a problem. They aren't necessarily going to go and get help or go to AA. You've got to find your own support systems if you're in the midst of that, independently of the alcoholic. Because it's amazing to me how many people have said, well, I'll be fine if the alcoholic just goes and gets help. But that's not always going to happen. And earlier, what you had said about going into the hospital, I had enormous fear around being hospitalized. I was terrified. And after I came out, I really felt like I had confronted my fears and come out on the other side. I mean, hey, they give you great drugs, hanging out, that oxycodone, that can be a lot of fun, but in moderation, because then there's another side effect that can be a bit unpleasant. But you watch TV all day, your food is being brought to you. I really felt like, okay, I have nothing to fear anymore. No fear of death. I'm kind of feeling like I got really busy after the diagnosis because I was thinking in terms of my legacy and what I wanted to leave behind. And I got 2 books finished. I was, just planning, right before going into the hospital. And then, of course, COVID came. So then the next book got finished. And I've been a writing fiend for this year. But yes, you're right. There's a lot of fear. A lot of fear. But I can tell you, I can testify. You can go through it and come out on the other side.
I have to say, my mind is still blown that your grandfather was like president of that. You are like a celebrity. Oh my gosh. And here you are over 100 years later, educating our community about, cancer health. Like, talk about things coming full circle.
Full
how
circle.
proud he would be.
And what else is mind blowing? The day I had my surgery in January was his birthday.
Wow.
I had lost sight that it was his birthday, and I was in correspondence with someone else who is building a community center in his hometown in his name. And we had plans, for a launch and gala, and of course that got canceled because of COVID. But he was the one who had been doing his biographies for the publications, and his birthday was the day I had my surgery. And they told me totally smoothly, no problem, one of the easiest surgeries we ever did. And I realized, oh yeah, thanks, Grandpa.
Yep.
He was looking over that surgery.
Wow. Well, I just want to, as we wind down and come to the last couple seconds, I want to thank both of you so much. Nina, thank you for sharing and for being so open. Dr. Psycher, thank you for also sharing and giving us your insight. Thank both of you for all that you're doing within our communities. And Nina, I'm looking for the second book. First book, Practicing for Love. That's the first book, Practicing for Love, a memoir that can be found on the website. And we just want to thank everybody. Please encourage you to if you have not seen Audre Lorde's The Cancer Journals, please, you still have time. That doesn't end until tomorrow. I want to thank everyone again for pulling up, bringing your lunch, and enjoying us during this circle as we talked a little bit about this. Please continue to watch. Milwaukee Minority Health Film Festival has a lot more in store. We're not quite done, and there's so much more to come. Thank you again, and have a blessed week.
The 2020 Minority Health Film Festival offers a diverse variety of films and events that we just wouldn't be able to offer in the in-person cinema experience. But I think what really makes it unique is the focus not only on public health issues, but the issues that really concern communities of color. If you're looking for a reason to engage or to try it out, this is the perfect time. Just go to mkefilm.org/MHFF